Okay, we are live. It worked. This is amazing. Um, all right, if you're here, let us know because we can't tell until that. See, this is the part I'm saying that Billy does. It's supposed to tell me if we're actually live. Um, it says live, but it's not showing me that any people are watching or commenting. So we'll see if that comes later. Um, I say we just get started because people will rewatch it later. So here we are with Dr. Keith, Green Juju's vet, which we are so excited about. Um, a little a little background. We met exactly a year ago at an event in Portland, and Billy was telling me he'd always told me how much he loved this Dr. Keith guy, and I had never met you. I think you are absolutely the perfect combination of like the science nerdy side of Billy and the kind of like woo woo energetic side of me. And I didn't know that really existed in a person until I met you. It has just been so fun for the three of us to work together. And you and I will go off on something, and then you and Billy will go off on something, and then it all comes together. And it has just been so fun to watch how we all work together and to watch how we think. Oh, somebody says they see me and not you. Do you see a little bar in the right-hand corner of your box down there? Maybe I do it.
Oh, there goes 3, 2, 1. Here I come.
Okay, there you are.
Oh, look at that. Now you get
Everybody
the,
see him now?
looks like I'm back.
I think you're
Beth,
back.
yes?
Um, so today we are going to get to know Dr. Keith a little bit and his backstory, how he ended up at Green Juju, and we would love to answer any of your questions along the way. So just pop them up as you have them. Um, but why don't you just start and let us know a little introduction about yourself and how you got here?
All right. Well, thanks first of all for having me. This is super exciting, and I feel the same way. It's been a really kind of a cool experience to be able to work in this realm where I feel like I have all these different facets of my professional and otherwise my life that kind of can be fulfilled and supported, and I can actually put them to use to help something really awesome like Green Juju. So I really appreciate that opportunity. First of all. So how did I start? So I was one of those people who was really lucky. From the time I could pronounce the word veterinarian, I knew that's what I was going to do. So my path has been set from a pretty early age. It was even so much so that I was like 12 or 13, and it was still kind of illegal for you to have a job. But I went to the school, and my mom signed a form so I could go work at the local animal hospital. And I started working cleaning cages, bathing cats, which was reserved for the entry level position. But it was a really cool experience because I got to really be around a lot of animals. And as I was working there, I started to get to do more and more stuff. So by the time I graduated and went off to Cornell, where I got my animal science degree, was able to actually pull blood and hold animals and do a lot of things that really gave me more of an insight as to how the profession operated. So I wasn't just like, a kennel kid. I got to really get an understanding of how things were done. So once I went to, as I mentioned, I went to Cornell, and that's where I did 4 years of my undergraduate. And then I stayed on there for 4 more years and got my degree in veterinary medicine at Cornell University. And then once I graduated, I don't know if anybody's from upstate New York, it's like pretty darn cold, and the cold, rain, and snow were pretty intense. So after 8 Ithaca winters, I decided I needed some sun. So I moved to San Diego, California, and I got an internship doing emergency and critical care. And when I got out of school, I was very much like an adrenaline junkie. I was going to save the world, and emergency medicine was the way to do it because I could save lives, and I was actually really good at it because I'm very much, especially at the time, I was very much an adrenaline junkie, and I was just like, it was really intense. And the cool thing about emergency and critical care is you learn so much over a short period of time. So in like 4 or 5 years of working in emergency, I think it was like the equivalent of like 10 or 15 years in conventional medicine because there's so much information that you have to learn, and you got to learn it quick. And if you don't make good decisions, there's the consequences, or the animal doesn't live. And that's, of course, that's not what we want. But it was during that time that I really started to question what I was seeing, because I started to see a lot of the limitations of what conventional care had to offer in those settings. So, emergency critical care is great when the animals got hit by a car, they got attacked by a coyote, whatever name of trauma you could have. That's how we save a life. So, we get in there, we can do the things to help work with them and save them. But it was really with animals who are older, okay, or if they had been maxed out on all the drugs that they had taken, if they had been, having chronic diseases, a lot of gastrointestinal problems, different forms of internal medicine disorders, cancers, stuff like that, where there wasn't really movement towards getting them healthy. It just seemed like the care was designed to keep them from getting just less sick. So, I saw a lot of those limitations, especially in older pets with maxed out on like anti-inflammatories that they still couldn't walk. So what ended up happening, and I think this is kind of like probably par for the course for a lot of us, just like you with your experience with Bailey, is that we come up against something that kind of shakes our paradigm and it really gets into our soul, like maybe there's something else. And for me, it was my dog, Max. Max was a byproduct of my Western veterinary education. So he had every vaccine known to man. He took all the pesticides, and he was on. By the time I graduated from vet school, he had already been diagnosed with inflammatory bowel disease and was on a prescription diet, like some sort of fish and potato thing. And he was, kind of struggling, but I got him through, and that was technically that was the standard of care. Well,
at that point,
how old was he when I got out of school? Probably 5 or 6, maybe maybe 7 or 8. So yeah, it was
age.
Yeah, so 7 or 8, like kind of middle age. You should have been a lot older. But what ended up happening when I was an intern in the emergency critical care hospital, he started showing kind of really weird symptoms. And he was a very he just kind of like make a funny step or a little stumble, or he just kind of like looked at me like a little tilted head. And I was like, something's off. And lo and behold, he ended up having a brain tumor. So, what ended up happening is we do the conventional thing is you do brain surgery. And he had a metastasis, or the cancer was already in his lungs. So we didn't end up doing, the surgery because it was not really good. He wasn't a good candidate. Wow. So he was maxed out on steroids, and, it helped for a little while, but then he had tons of side effects and he started really declining. And what started happening is he stopped eating. He was throwing up blood. His quality of life was miserable. So I was faced with looking at euthanasia, or I could try something different. So my girlfriend at the time had suggested, you should go see a holistic vet. And I didn't have a holistic bone in my body. I mean, I got through vet school eating microwave hot dogs, so it's not like I had a good understanding of like what healthy nutrition was. So, but I was like, when you're faced with that situation, I was like, okay, I'm going to do something. I couldn't just let him go without having a sense that I tried more. So what ended up happening is I got some guidance from a holistic veterinarian in San Diego who was able to, basically he just, what he did is he just sat back and he said to me, he goes, those things you learned in vet school, maybe not all of them are right or correct, or maybe there's other ways to do them. And what we ended up doing is I got him off of this kibble that he had eaten forever, and we put him on a fresh raw food diet that I made myself. And we started some homeopathic remedies and some herbal remedies. And fairly quickly, Max started like rallying, and I was able to. The other thing he said to do is really lower his dose of prednisone. So I said, okay, we'll lower the dose of prednisone. I actually ended up getting him to like a really low dose, and I changed his food, and he started eating. And Max lived another 6 months. Okay. And given that he was going to die, and I got 6 months, and the thing is, to the day he died, he wagged his little tail, and, and he ate till the day he died. And he had his last supper was like thick cut steak and bacon and all this kind of stuff. And he just, and it was a beautiful thing. So I consider, I still get a little choked up.
I was actually just thinking how impressed I was that you were telling this.
I know. It's like 20, I don't even know, lots of years later, here I am, and it still does it to me. Well, there's pictures up here on my wall too. So he's always looking at me. But what I consider what I do today, and like the message that I bring to my people and to their pets, is Max's legacy. And it's the experience I had with him opened my heart to so many possibilities and ways to help that I never would have had otherwise. So I owe it to him. And he's been my teacher that really, I guess, laid the foundation for all this that I've done today. So that experience with Max, it was a point in my life that I call the awakening. Okay, where I became aware that what I didn't know anything, and what I thought I knew, and this hubris that I had around the care that I was giving wasn't really founded in results. It was founded in just, this is the way we do it, like the dogma. This is the way it's done. And the awakening created a lot of questions. And that's what my questions led to me to learn. And that's where I started adding, like, any modality I could learn, I did. So I started studying acupuncture. I started studying Chinese herbal medicine. I took like every Chi Institute class that they had on herbs, I took in 1 year. I just was flying to Gainesville, Florida, like every other month, taking classes. And that was back in, I'm going to age myself, but that was back when Dr. Shea had his Chi Institute, and it was in the little Quality Inn. Right now, he has like this huge, like beautiful manufacturing facility and a school and a university, and it was this tiny little thing in the Quality Inn in Gainesville. So we've come a long way. But studied herbs, and then I chiropractic. One of the things, a big shift in my life was also Reiki. So I really tapped into more the energy medicine side of things. But I really hit my ground as an herbalist, and the plants for me have given me most of the answers that I seek, and they give me a lot of insight as to not just medicines to use for my patients, but for my own being and my family. And also, I connect in nature, and that's where I really find it was my source. So it's really opened the door. So that kind of really opened up that lifelong learning pathway. And I still, to this day, I'm on that path. And I mean, I'm an avid learner, so I'm always researching. I think Billy and I are in like this competition for like who can be the nerdiest dude. But right now he's winning. But
no, I don't know about. I mean, nerdiest dude maybe, but like most you guys can learn. You guys are crazy together.
Yeah, I know. So it's been a really cool experience, and I so what ended up happening. So once I started getting all those modalities, I needed to work. I needed a place to work. So I was fortunate enough to meet my wonderful wife, Beth, who's a business person, and I'm not. So it was nice to have someone who had my back, who could help us like put my skills to use in a forum that allowed us to also make a living. And we started a small practice in San Diego. We rented a small beach cottage. And what we did is we turned it into our clinic. And basically the bedrooms became our examination rooms. The living room was our reception area, and the kitchen was our pharmacy. And then very soon it was like just full of herb bottles and all this. So it started just me and Beth. We were this team. And then we quickly added a massage therapist, and I took on another vet and a chiropractor. And by the time I sold the place we sold the place in 2013, we had like 3 doctors working, 2 chiropractors, and a massage therapist out of this little place. And we had already built another room off of it and everything like that. So it kind of really blew up and got bigger. And then I sold the practice there in San Diego, and Beth and I moved up to Portland. And, that's where I live and practice today. So that's then kind of like, got the ground running, hit the ground running up here, started doing house calls. And then we started a brick and mortar up here. And then one thing led to another, pandemic happened. And in that process, I started to look at how I could leverage all the things and the knowledge that I have towards helping the bigger picture. And that's where I started working with ThornVet. And that experience was such that it allowed me to help educate not just veterinarians and not just clients, but veterinarians about, holistic healthcare, but especially around nutritional supplementation. And I got to do a lot of research around ingredients and making up products and formulating. And it's been super, super fulfilling for me in that process. And then, fundamentally, and we can talk about this some more, I'm sure, but the food that we put in our animals' bodies is the most important medicine they take every single day. And Max was my first teacher in that. And I live that lesson every single day. And that's why when, we got to talking, it felt like such a natural place for me to be is here with you at Green Juju, because in my opinion, I don't think that there's anybody doing food on the level that you are for our pets. So that just was a really easy segue for me to come on board and join the party.
That means a ton to me, and I really appreciate that. In the, what, has it been a month and 6 weeks now?
I think it's 6 weeks. It's been a short time.
But you've already had like a major impact in like, what, 3 or 4 products that we're doing. So It's been very
Thank
fun.
you. Yeah, it's been so fun. So fun.
Yes. Okay, so what did vet school look like then? How did it influence you, and how has that changed where you are today?
Okay, so let's approach it kind of like, how do we learn nutrition in vet school?
Okay.
I think that's kind of like the first step, because we are taught nutrition in vet school by the pet food companies. That is the reality, and it's still the reality today. So the Hills, the IAMS, the Eukanuba, those are the folks who are funding our education. We don't actually have very good, solid, like foundational courses in nutrition. At least we did not. I graduated in '99, so it was a while ago. But I think there could be some changes. But we were basically the pet food companies, they come in, they buy you lunch, you get color glossy brochures, and you get free pet food while you're in school. So you're going to then very much be like, this is how we feed our pets. And I bought into that. Max was on Hill's Science Diet until he developed inflammatory bowel disease on the diet, and then he had to go on to a prescription food and this and that. So we're never taught how pet food is processed. We're never taught how the ingredients are selected. We're never taught how that food is preserved. And we're never taught about how those diets are designed relative to the evolutionary principles of how dogs and cats evolved as species. So we're really not given that information. We're just told to presume that the people who are making the diets know this, and we're just to apply those principles by feeding those foods. So Max was my teacher that didn't work, right? So I had to look outside the bag of kibble. And that's what I really started to do. And that's where most of my initial education, besides becoming like acupuncture certified and learning herbs, so much of it was actually digging into, how do we feed animals? How did the animals evolve eating for thousands and thousands of years? What is it all of a sudden in magic that happened in 1950 when they developed kibble, like, or 1945 or whatever? What was so magical that now all of a sudden animals, if they don't eat kibble, are going to die? So I was like kind of gobsmacked by this principle, like we just have to take it all on faith. And that really got me digging in. And I started to get somewhat of I would say, an activist around it, where I was fairly staunchly opinionated around the process. And for better or worse, but at the same time, I felt strongly, and you can tell with working with me, I'm passionate and I care. And if I'm going to feel strong about something, it's going to become clear. And so it was. And I think I have since changed my path a lot. Not patent, I haven't changed it. I guess I should say I've tempered my path, and I've been humbled a lot. And I think that the journey I've had in helping my patients has been one that has been very insightful. And it's taught me a lot that there is no one way to do anything. And when you have such a strong opinion about something, the universe is guaranteed to smack you down. And yes, it has on multiple situations. So I don't, we don't know. As the beauty of life is, the more you learn, the more you realize you don't know anything. Yeah. So I think there's the way we have to kind of approach nutrition for our pets is we start with the foundation of the most whole, real food that we can put into them is a good starting point. And then we can see how their bodies respond to that. And that's going to be what tailors how we support them. Some animals may not do so great with like a fresh raw food diet or a frozen raw food diet. Some may do better with maybe a freeze-dried diet, or they may need some help working up to build up that digestive capacity so they can then tolerate or work with that food. So, there's lots of nuances and lots of ways to approach it. But I think having an open mind and trying to tailor the diet to the individual rather than trying to fit the individual to the diet. Okay, so you're actually reverse engineering. You say, like, what does that pet need? And then I'm going to work with that, and trying to consider and appreciate all of them as individuals, because I think that's where we get into this like cookie cutter realm. And that's what I think a lot of commercial pet foods are, is like, it's just this, feed this kibble, right? Or this canned food, or if you don't feed it, there's going to be consequences, right? If it's not complete and balanced. And I always say, like, I don't sit down with a spreadsheet every time I have a meal, right? And I don't do that for myself. I don't think we necessarily have to do it for our animals, but certainly over time, we want to make sure that they're getting the things they need in the appropriate ratios and balances. But I don't think animals are going to keel over and die if we eat real food. I think it's actually fairly natural to feed them the way Mother Nature intended.
Yeah, I agree. And, I think nutrition can be so intimidating and as you're speaking about spreadsheets with every meal and everything, but in reality, there's so many different ways to do it, whether that's a full raw diet and you're adding things to it, or you have a bowl of kibble and you're putting some toppers on it. Like there's so many different ways to go about it. And it doesn't have to be too intimidating to just take a few steps, you know?
Exactly.
I'm going to answer a couple questions really quick.
Okay.
There are questions about where people can find holistic vets. We actually have a vet locator on our website, which could be a good place to start. Or also, if you go to AHVMA, to their website, they'll have vets in your area. Somebody asked if we've ever considered bulk boxes with box red and white meat combined. We did consider this, and we talked to some of our distributors and retailers, and were convinced that it was not going to be a great idea. So we considered it. Can we send questions about our pets to Dr. Keith and get his suggestions?
It's a little
Correct me if
tricky.
I'm wrong.
Yeah, it's a little tricky because
So
sorry, go ahead.
we have our info at Green Juju, and you're welcome to send any questions you have there, and it will get through Billy or I or Dr. Keith. But if you have questions, I mean, that's assuming it's like a Green Juju food related question. If they're just health related questions, then they should probably set up a consult with you directly. Would you agree?
Yeah, that's correct. So there's the nuance and the challenges that we have with giving like medical advice in a forum like this is that we have to have what's called a veterinary client patient relationship established, which depending on the state or the province that you're in, you have to have an in-person medical examination to establish care oftentimes. What I often do though for some folks around the country, and even for some of my local clients, is we can do telehealth consultations, and then that can at least be a guidance and some support. It's difficult for me and illegal for me to actually make a diagnosis per se and prescribe a pharmaceutical drug. I do make diet recommendations. I oftentimes will recommend supplements and herbs that feel right for the pattern of imbalance for those patients. But I'm very careful because of the legality around our veterinary client-patient relationship. So yeah, like quick, easy questions or something like, does this diet resonate, or can I try this? Those types of things I'm happy to kind of give some support for. But if it's more like my pet has XYZ disorder, I'm doing this, can you tell me what to do? I can't really without a further kind of like a complete consultation.
Yeah. So an individual consult with him, that would go directly to you and through your website.
Correct.
Okay. Okay, so these days, how are you approaching nutrition now?
So we come a long way from the time of kibble for Max, right? And I could say that, my client base and my clients know that I'm seldom ever going to recommend a processed kibble diet. I recommend, if they have to do it or they want to stay on it, I'm going to support you in any decision you make. But like what I love about Green Juju is to add some life to the bowl, right? So we can actually take some of those greens and we could take some of those fresh foods and add that to whatever you're feeding. So that's going to provide a really good foundation of support. And then what happens, this is almost always, in my experience, is when people start doing that, it's empowering because you feel it. Like you feel the love that you're giving your pet, and it empowers you to do more. So when you get that positive feedback from your dog or cat where they're like, I want this, or I have the classic, and you probably get this all the time, is that my dog really didn't like his food, but now he really likes the food, and they're like, they're there, they're barking, they're excited. There's this brightness and there's vitality that the food is bringing out, right? So it's like self-rewarding cycle of to say, okay, we're on the right path. So once you start seeing that smiling face and those bright eyes looking at you, you're going to want to do more. So then you can start adding in other more whole, fresh, real foods. And the thing that to remember, and I tell people this all the time, is it doesn't have to be an all or none phenomenon. Do the best that you can. Feeding a fresh, whole, raw food diet to an 80, 100-pound dog can be expensive. So you want to do what feels best within your budget, but that allows you for you to access that support that you can give them in addition. So just try and find that path forward. Sometimes even adding just goat milk into the food can be helpful. But there's so many times in my experience where food is medicine. And I like, for example, I'll give you a quick example for allergy cases. Almost every allergy case I see, I work on their intestine. I work on their gut. I work on get them on fresh, real whole foods. I try and reduce carbohydrates. I try and reduce things that are processed that are going to drive more inflammation into the body. And I get the gut in a good place because 9 times out of 10, if you make the gut better, everything else takes care of itself.
Yeah, for sure. Okay. Let's talk about the values that guide how you practice and how that brought you to Green Juju.
So as I've kind of shared this before, I practice from the heart. I treat all of my patients as if they were my own. And when I do that, I feel like I can't really do wrong. Now, I'm not making the decisions for them, but I come to this situation. I said, if this was my dog or cat, how would I want to be helped? And if I bring that to the situation, that's the best I can do. And I find the animals know it and the people know it. And when you can operate from here, so many things can get better just from doing that. So I also, one of the other mantras I have is that just because we can doesn't always mean we should.
Mm-hmm.
And there's so many times I see people putting their animals through the rigmarole or through the ringer of the diagnostic vicious cycle of repetition of ultrasounds and MRIs and aspirates and biopsies and all these things.
That's so much trigger for me right now.
I'm sorry. Yeah, so
I remember all those things.
Yeah, so it's all those things, and there's so much sadness and fear and worry wrapped into that dynamic that it's unhealthy for the whole home, for the whole situation. And I oftentimes think is just like I said, just because we can doesn't mean we should. So if we can start with like what's for the greater good of this situation and what's going to be for the greater good of that animal with this person, and maybe not putting that 18-year-old cat through a bunch of expensive diagnostics, that's not going to change what you're going to do. Mm-hmm. So why do all those tests, right? So that's just kind of that one fundamental thing I come back to is like, what's the feels right here? So if I can find what feels right here and give that guidance from the heart, then a lot of times that's going to become clear what the path or journey is for that individual pet. So that's kind of like, that's really what guides me. And also I fundamentally, I try to do no harm, is I want to try and take an approach to caring for my pets that's going to be supportive, that minimizes risks and doesn't put them at risk of having worsening problems or more challenges or put them on medications that could create more problems than we're preventing.
Mm-hmm. Okay, let's stop for a couple questions. There's a question on here. What and when will Green Juju BFCM Special B? I don't know what BFCM is. Can you tell me? I should probably know.
BFCM Special B.
I've been seeing things on social media about the formulation of your diets, and since they are so rich in organ meat and hearts, that there can be way too much copper in the diets, especially if fed long term. Is this a legit concern, or do you have research regarding copper levels in your diets? So we've seen this too, and it's actually funny because the information you're seeing came from us. Those are the nutrient panels that we give out when people ask. I know you, Billy, have been talking about this a lot lately. Do you want to take this?
Oh, sure. I'd love to. It's a great question. I'm sorry. I have to wear readers, but they get that weird shiny stuff. So Brandy Edmonds. Brandy, is a wonderful question because it shows you're very informed, first of all, and you're looking out for the greater good for your animal. And that's huge right off the bat. So it was one of the things that I looked at when I came on board with Green Juju. I said, give me all of the info, and I wanted to dig into everything, and I did with like a fine-tooth comb and looking at all the nutrient analysis and all that kind of stuff. And that was a question that came up to me because when you look at the minimum amounts for AFCO for copper, and then you look at what Green Juju diets are providing, it's significantly higher. And the difference is that the form of copper that is coming from the food from Green Juju is in a whole food form. Okay, it's coming from those organ meats like the liver that are going to be higher in copper in its natural whole food form. So what the challenge is and what we're perceiving is and I think just so everybody is on the same page. Now, copper in and of itself is not bad. Okay, where there becomes problems with copper in pet foods is for animals who have a genetic predisposition to not being able to process or store copper, that they can accumulate copper in their liver cells, which creates inflammation and a form of hepatitis. Okay, it's called copper storage disease. Now, there is some thought, and this is a kind of fairly new research, that they can have inflammation in the liver that may not be necessarily related to copper, but because of the inflammation, they'll see excess amounts of copper in these inflamed livers. And what there's been a connection now that's made is that maybe some of this excess copper that's in these pets who have inflamed livers is coming from the diet. Well, it turns out the most likely form, because of essentially what Billy has informed me, is that we started seeing this after they changed the AFCO approval for another type of copper synthetic. Okay, so the challenge, I think, for these patients is the form of copper that's being put into the pet foods. And when you're using a synthetic form of a nutrient like something like copper, that has more of a potential for bioaccumulation, or for the body not to necessarily recognize what to do with it. And then it can set the pet up for having an issue with storage or causing more inflammation. So long story short is, we do not feel that our diets, even though they may have higher copper levels, because the form of copper is natural, coming from the whole food source, we're not likely to have that accumulative effect that you're seeing. Now, with that being said, if your animal for sure has copper storage disease, it's probably a good idea to be mindful of the levels of copper that they're eating. And this may not be the ideal, or at least there our whole food, raw food diets may not be ideal for that particular individual. Now, again, with that being said, there are some potentials that we could still find that to be okay. So one thing you can do if your dog or cat, or especially dogs, have a liver disease, what you can do is get blood work as a baseline. And then you could try on the Green Juju raw food diet, feed it for a month, 6 weeks, and then repeat the blood test. Now, if the ALT, which is one of the liver enzymes, stays normal, that's likely going to be okay then, right? So that copper isn't causing an issue. So I think it's important to not completely discount the use of these diets in animals who may have liver disease, but you should just be careful in applying them. But I think for the general pet, dog or cat running around, the copper that's coming from the food, because it's in a whole food form, should not cause problems. Is that a good summation?
Nailed it. That's awesome. And that also just goes to something we talk about a lot in terms of whole foods versus synthetics generally, and why I was so passionate in doing this entire company that way. Because my dog Bailey, who started all this, had cancer, and I didn't go to vet school. I didn't know nearly what you do, but I did know that she was fighting, and I was trying to help her. And what I knew of synthetics was that it took more work for the body to break it down. And I was like, she doesn't need to do more work. She just needs to focus on this one thing, like just live. And so that was kind of what set this company to be set up so much on whole foods. And I know it's something that we talk about a lot. I know you're going to do a webinar on it soon, but if there's any little preview that you want to give people.
Well, I think it boils down to the simplistic, it's very simple, is that when you give food, the body takes that information and knows what to do with it because it's in a form that it recognizes. When we take something that's synthesized in the laboratory, the body doesn't always know how to react to it. It's not going to take in that information the same way. So oftentimes it has to change that compound somehow, or it's going to have more of it to actually absorb enough that it knows what to do with it. So then you're ending up running into situations where you may actually create toxicity because you're giving super physiologic levels of these particular nutrients in order to get enough into the body. So I think that's where we run into challenges with some of the processed kibble diets, is that so when a diet goes through processing, especially ultra processed foods, when they're extruded at high temperatures, that changes the nutrient content of the food. And it changes it so much so that they're not aware of what's present or not present anymore. So they put in a micronutrient, like a multivitamin mineral, kind of like a powder that covers all the bases, but that doesn't necessarily take into consideration what's still present in the food. So you have these unknowns that create a room for error where we may actually over supplement a particular vitamin. And then when you're using synthetics, your margin for error is much smaller because if you put too much of a synthetic in, you can reach a toxic level much quicker than if I'm taking, it takes a lot for me to eat. I'd have to eat a lot of food to get like an excess amount of certain types of ingredients into my body. But so because the body is in a whole food form, it's not going to be able to do that. It's like almost a protective mechanism. So when we're using synthetics, it makes a much more a room for the potential for their toxicity to come in. And it may not even be something that's going to be registered on a test or anything like that, but in your own individual animal's body, it could be considered a toxicity. And I've seen it with using synthetics with my own dog, where I've actually seen it coming out, where like you could tell that they're not feeling well, or they even have a loose stool, stuff like that, where the body's just like, whoa, what am I doing? Because it's not necessarily a form that they're recognizing. So either A, it doesn't resonate, or they have to take in so much of it to actually get enough to do something.
Great. What Green Juju products are you recommending in your practice these days?
Well, so I'm really super jazzed on your the diets. Like that's been something I've been really excited about lately. But I've always, ever since I first saw the Just Greens, or it was the Just Greens when it came out, and this was years and years ago when it was at Meat, and I was there to pick up something, and Heidi said to me, "Have you seen this?" And I was like, "Oh, that looks really interesting." Well, and she's like, "This woman up in Seattle's making it." I'm like, "Well, cool." So we started. Started recommending it. It says, because I like, if you can add something to food, especially like, just a quick note. So I think that like, while I think raw food diets are great, one of the criticisms that I have is they don't oftentimes have the right balance and type of fiber. So when you can give something like the Just Greens or the Bailey's Blend, then we're actually providing, a really nice variable fiber source that helps promote the growth of organisms in their intestinal tract or their microbiome that otherwise would not be getting supported, because they're not necessarily going to come from a diet that's so high in protein and meat. So what we want to do is have diversity, and what they call, microbiologists call, richness. You want to have a rich microbiome, which means you have lots of different types of bugs. So if I'm just eating a raw food diet, I'm going to have a lot of types of certain bugs that are going to grow in that type of environment. So that's why it's good to add in things that are going to make the body have more diversity, because all those different organisms bring something else to the table. And if I have a whole group of, like, I'm just going to say a Blautia species, and I have a whole lot of them, so they're bringing what they do, but I have very few Bacteroides. Well, then I'm going to not have what Bacteroides brings. And that's going to be a whole number of different metabolites. It's going to bring something to the environment of the intestinal tract that's going to make other bugs grow stronger. So you're losing out on so just like I think in life, the more diversity you have, the better off we're going to be. So that's what I'm a big fan of, like the greens. I'm a big fan of the diets, but I do find some of the whole food supplements can be really helpfully applied too. So for example, the BAMS beets, I like them for, this is actually, I've started to use the BAMS beets for dogs with GI ulcers. Okay. Because you actually have like the purple cabbage, and there's all these compounds. I'm not going to bore you with the scientific names, but there are these compounds that are in these vegetables that actually have an ability to build up the mucosal layer and protect the intestinal tract. Plus, we're providing a really nice form of phenols, okay, which are a type of compounds, very much antioxidants, and the phenols feed the bacteria in the gut. We're also getting a really nice fiber source that's going to help provide a prebiotic food source for the bugs. And it's also going to produce other compounds that are providing antioxidant support, so reducing oxidative stress. So just a really nice way to simply use whole foods to initiate a whole bunch of healing within the body's gut. Okay. Then same thing with the Lewis blend, where you have the fermented turmeric, right? So I've done a ton of research in the last 5 years. One of the things I worked on with my other company I work for is working on a longevity formula. And I've been in that longevity rabbit hole for 4 or 5 years. And in that process, you learn a lot about different herbs and compounds. And curcumin, which comes from turmeric, is probably one of the most versatile, diffusely effective, system-wide supportive antioxidant pro-longevity compounds on Earth. And it comes in a really bioavailable form in the golden paste, because the fermentation of the turmeric root brings out all these nutrients, especially the curcuminoids, which the body then takes up, and then it feeds into all these pathways to promote healthy aging and longevity.
I feel like you like that one.
I do.
I can feel that. um, okay, we have a couple of questions here. There's a question about the benefit of raw goat's milk. Does cow's milk have similar benefits or goat's milk better? Are we talking about raw cow's milk or not raw cow's milk? Let me know. Is this food okay for a senior dog with a history of pancreatitis? I know how Billy would answer this, but I want to hear what you think.
Um, I'm going to say, so it's kind of a little bit of a loaded question because there's every individual with pancreatitis can be different. And just because you're older doesn't necessarily mean you can't have fats. It's just a question of how the body responds to those fats. And also the question of how those fats are presented to the body and the form of which they're in, whether or not they're, so for example, like the Green Juju diets are going to have a more healthy fat content because they're pastured. Okay, so you're going to actually have more omega-3s in there as well. And because I find pancreatitis to be worse in animals who are eating processed foods. I see animals who eat whole food diets have much less pancreatitis because you're getting more moisture and because the body doesn't have to work so hard to process these nutrients. The other thing that processing brings to food is it increases the level of inflammation, which pancreatitis is just inflammation of the pancreas. So we want to try and reduce that potential. I do think that the fat levels are going to be a little bit higher, but what we're going to see is like what I recommend doing in an older dog who has a history of pancreatitis is you start with a really small amount and you work your way up and you see how that pet responds. And if at any point they start having more indigestion, so stomach rumbling, acting nauseous, those types of things, or if they get that loose stools where you start getting mucus, like a sausage casing on the stool, that's going to be more signs that you're having, you like that one. If you're having inflammation in the intestinal tract, it's going to give you a good tip off that you are. So I don't think the fat levels in the Green Juju diet should be preclude you from trying it. You just need to do so cautiously. And there's times where I see animals who I would probably expect may have a harder time with the food who thrive on it. So I think that the question is, it depends. The answer is, it depends. So how would Billy have handled that? I could ask him myself someday. But
Similar in a lot of ways. He thinks that it's often driven by the starches in processed food more so than the fats.
And it's inflammation, right? So you're driving the inflammation.
Yeah. So that's, I mean, much like you said, every pet's going to be different and you have to see how they do and everything, but it's not a fat is the issue. Like, we know that starch can be an issue and then every dog has their own unique things around it. But when you were talking about the processed diet, that was similar to what he was.
I think the other thing about that, so what you mentioned makes a lot of sense in terms of the starch, because what that does is it creates the insulin. It stimulates the pancreas to secrete insulin. So you're going to also kind of like create some of the, especially if there's inflammation on board, you're actually creating insulin resistance, which is then going to kind of create more stimulation of the pancreas. And then it's just like this whole like vicious cycle.
Yeah. Okay, a couple questions. Somebody wants to know about the Just Greens and if you can thaw it and refreeze it in ice cube trays. And yes, you absolutely can. Somebody wants to know if the raw cow's milk is as good as raw goat's milk. Billy and I will be doing a live in like 2 weeks, and he would love to give you a 20-minute answer on this. But I'll tell you that they are both great and they have different nutrients in them, but one isn't necessarily better than the other. It also has a lot to do with like where the animals are living and where they're raised. But look forward to that because he'll have fun with that one. Okay, is this food okay for a dog with an autoimmune issue, MUE, currently on pred and cytosar? Lots of GI issues being on these meds.
Yeah, so it is okay for an autoimmune patient to be on. I mean, you are on immunosuppressants, so it's always good to be careful in those types of situations so we don't potentially inadvertently make something worse. Now, one thing that's important to speak about with food safety relative to the Green Juju, and I think all pet foods, is that the FDA has a zero tolerance for pathogens in pet food. So all the food has to be rendered essentially like not sterile, but have to have there has to be very, very low pathogen burden in order to be able to be produced and sold in the United States. So Green Juju goes through the process of HPP, which is high pressure pasteurization, to render the food very safe. So it's going to be okay even if your pet has to be on immunosuppressant medications. Now with that, I think a whole food diet, especially Green Juju, would probably be a really good piece of the puzzle for your dog. Okay, because what you're doing is you're providing a really bioavailable source of nutrients that the body's not going to have a hard time assimilating. Okay, because it's going to be in a really whole food form and it's going to be very accessible for them. You just want to make sure you go slow. Okay, this is the other thing, my mantra, right? I have lots of mantras, you'll see, but start low and go slow. Okay, I do that with herbs. I do that with food. It's just the way to live life. Start with a little bit. Sometimes even pretend the first time. You put it in, and then you can gradually work your way up. And then, yeah, exactly. Just pretend. I'm going to put this in, but I'm not. So, because I found that if you start with a really small amount and you work up slowly, if they have a negative reaction, it's not going to be like a horrible, like, blowing up. If you go like full on complete diet change without any sort of transition and their pipe stream diarrhea and all this kind of stuff, that may not happen, but you're going to likely have more of a reaction if you go full bore. So if you start small and work your way up, the body has a better ability to assimilate and regulate and understand what's going on, because especially if they've eaten processed pet food for a long time, or the other thing with your pet is because they're so toxic from the medications is their gut may be in a bad place. So you're going to want to go real slow. So their body's like, whoa, this is food I haven't had before. And it's just going to take a little bit of time. One thing you may want to do in that situation is lay the groundwork, okay, for you to introduce this new food by getting the gut terrain, the bowel environment to be healthier, okay, because the medications that they're having to take are obviously taking its toll. So what's happening is that microbiome, the balance of all the bugs that live in that gut, has gotten sick or out of balance. So what we want to do is probably put some of those good bugs back in there, or give that information to lay that ecosystem down so it can be healthy. So then when you do go to introduce anything like a fresh raw food diet, that they're going to be much more capable of accepting that, rather than having this reactive kind of like toxic environment that then you're putting this fresh food into and the body's like, no, I can't do it. So you need to set up the stage for success. And you can do that by getting on some beets, maybe the wild mushroom probiotic. Okay, because that probiotic is going to come in and it's going to just almost create this beautiful ecology environment where everything wants to be healthy. And then the pathogens will go out. You do that a little bit before and then start a slow transition. I think you'll probably have pretty good success. And if you don't, you can reach out to us and we'll let you know what we would recommend from there.
I think the beets would be great for that, between the detox and the gut support.
Yeah.
Okay, wouldn't you? We've already had customers come in as a result of Dr. Keith. Thanks. We are thrilled to have a local veterinarian breaking the mold and recommending raw whole food diets instead of processed kibble. I was supposed to come to that event. Was that last night? 2 nights ago? I was sick and in Portland and I drove home. I'm sorry I missed you, but I heard it was great. Okay. I have one other question for you, Dr. Keith, but if you guys have any other questions, throw them in here and we will get to them. Okay, so what are some of your passions in this profession, and how do you see tying those into what you are going to be doing with us?
That's a really good question. Passions, I got a lot. You feel it. So I think that I think one of the things I'm really passionate about is bringing this information to more people. And I think that knowledge is power. So the more that we can educate our population about the benefits of just getting to the simple fundamentals of feeding good, whole, real food, it's not a radical concept. And in fact, if you look at it, the radical concept is processing food to the level that it's this burnt brown ball, right? It's fairly more natural and in the flow of things to think about just feeding real food. So if we can just, so I'm passionate about that, is bringing that information to more people and doing so in a way that doesn't have to create this us versus them dynamic. Because I think it's so prevalent in society that we don't have to look at our animal care that way. I think that, and this is a comment I want to make, is that even though I may operate outside the box, I'm very respectful for all of my colleagues. And that comes to the people on the conventional side, the Western side, the integrative side, the holistic side, the uber holistic side. All of us, we all have the intention for the well-being and betterment of our animals and their people. So we may come to it from different approaches, but just because we come from a different approach doesn't mean that we're wrong or right. Okay, there's no one right way to do anything. So you have to find what works for you and your pet and how that resonates with your heart and how that resonates in your home and with your budget and all the other types of things, right? So those are considerations that I think are really important, but it's good to have a veterinarian that you can talk to about this. And while they may not advocate for you doing something like this or say, yes, go do this, they should at least be open to seeing what's happening while you're doing that. And if they can support you in that process, then you've won. Because then you also on some level, because this is what I see happen a lot, is you can actually shift the gears of their perception. And then when you've done that, you have just helped all those animals that then come into that veterinarian's door. So it's opening the door, and we all have to start somewhere, right? I had Max. Max was my teacher because, like I said, I was eating microwave hot dogs through vet school. This is like I was not nutritionally founded here at all. And honestly, caring for my animal patients was what started me taking care of myself. Mm-hmm. Okay. And one of the things, and someday I'll write this book before I die. I don't know, I keep talking about it. It's called Heal Your Pets, Heal Your Life. Because if we actually are empowered to do the work to care for our pets, it's amazing how much we actually are caring for ourselves.
Yeah.
And there's this, I call it mirroring. Okay. We can walk into a house. For years, I did house calls, and I could walk into a home and I could tell if the home was sick. And then I could say, there's nobody in this house who's going to get well. So you have to change the whole home. And that's a big lift. And when you're in house calls, you can start to realize like things that you never got when they were coming into the clinic, because you're like, it's like this snapshot in time. But when you see the dynamic in the home, it changes things. So there's a lot of mirroring where people and their animals mirror the same patterns. So in order for the home to be well, everybody has to be well.
I love that. That is so true and so
important. I see it every day. I mean, classic is like the really high strung owner who's like super stressed out and like, and their cat's super high strung and stressed out. And then you're like, well, I think your cat has a problem related to their stress and anxiety that's affecting their digestion. And then they go, that's my problem. And I go, I knew it. So
you get number one.
Oh, that's, but you know, or I have, this is the other one that happens all the time where I'm like, I think your animal needs to go on this herbal formula. And they go, that's the one I'm taking. Mm-hmm. So, you know, and that's happening, that you're on the right path because there's that same pattern of disharmony. So that's what I think is, I kind of get jazzed about it, because I think that the connection that we're making and caring for our pets, and when we take it to the level that like people are feeding Green Juju, you're upper echelon of the pet owning population, because you're putting that much intention into the food, that it's very, very empowering. And when you see that, it can be a transformative process in their own life. Where I have had people who started cooking for their pet, and they started like living better themselves. And then they started like, actually the whole household gets better. And you're like, wow, look at that, you know? So it's kind of cool. So in that space, I think that's kind of like, I'm really excited about that, and just trying to bring more education and in a loving way to like, and not get into this like dichotomy of us versus them. And, you know, I've had to defend myself for 25 years because the way I practice, I'm under the microscope all the time. You know, it's like if anything goes wrong, they always blame me. Okay. Because it's always the herb or the food, right? And it couldn't be the hardcore pharmaceutical that you prescribe. It's always got to be the outsider. So I think that's an important dynamic. In regards to like other things I'm fascinated about, I'm a super big longevity nerd. I love to study how we can help our bodies and our animals' bodies live healthier and then subsequently longer, because there's all this cool information that's coming down the pipe. And I just recently did a continuing education webinar on longevity medicine. So it's a real important rabbit hole that I've been kind of digging around in for a while. And it's cool to bring in the Green Juju piece of that, because you can use those whole foods in a similar fashion. So you're actually, even like on a fundamental basic food level, you're actually encouraging all these really important pathways to be upregulated that help the body live healthier and longer.
That's awesome. I am excited to learn more alongside you and work on these things together because you teach me something new every time.
Oh,
Okay, there's one last question here, and then I think we'll wrap up. Um, so somebody's asking about ordering directly from the website, minimum amount, and our Black Friday, Cyber Monday. That's what it was, though. Um, yes, you can order directly from our website. The, there is a minimum that applies to frozen products, so there has to be 6 frozen products to a cooler, just so we aren't randomly shipping empty coolers. Um, we don't run sales on our website because our primary focus is just to sell to people who can't get to a retail store. We want to support our retail stores primarily, which is why we keep all of our prices the same as the retail store, and we do charge shipping. So you're not going to get a deal on our website, unfortunately, but it is there if you need it. Are there any other questions for Dr. Keith before we go? Okay, well, I think this was great. Thank you so
super
much.
fun. Super fun. I look forward to more of our engagement like this. It's fun.
Yeah, so you can expect to see from Dr. Keith Microbiome Monday, every Monday. And then we're planning to do like a webinar once a month or live or something like this. And then there will be a blog post followed up with that. In case you're a reader and not a watcher, you'll get the same content from both. So we'll probably change things as we go along. But that's what we're planning on doing for now. And we're very excited to start getting some info out to you guys.
Yeah. So, and the other thing too, and I think you probably already did this. If you guys ever have things you want to learn about or things that are intriguing to you that you think we would want to share with the rest of the Green Juju community, let us know so that we can kind of get it out there. Because if you're thinking about it, someone else probably is too, and it's great for us to share because that's how we all learn.
Yeah, that's a great point on anything we post, like especially anything Dr. Keith related that we post. If you post a question in there, we will consider that for our next live or our next webinar or something like that. We'll try to incorporate it because we do want to talk about what you guys are interested in. All right. Well, thank you, everybody. We'll see you next time.
Thank
Bye.
you. Bye.